The wrong way to use the Wolverine stack is choosing BPC 157 and TB500 first, but the right way is asking why your injury is not healing properly in the first place. Now, in this video, I'm going to show you what these peptides may do, what our human studies actually show, and in the end, I'm going to give you my 5 questions that I ask every single patient and client before we put them on any type of protocol. My name is Raphael Al-Najaar. I'm a medical doctor specializing in men's hormonal health and performance, and I help men find the proper cause for their issues before starting another compound or another protocol. And I make these kind of videos because I get questions every single day about peptides, about what I think about peptides, and if anyone should really start using something like the Wolverine stack or just BPC 157 alone. There's so much information online, either it's hype or it's fear, and both of those can lead to bad decisions. So I just want to give you the medical answer and show you what data we have currently. And before we go any further, this video is obviously only for educational purposes. This is not medical advice. Do not change, start, stop. Don't do anything medically based on a YouTube video. And always speak with your own doctor before making any decisions. Now, with that said, I see why people might find the Wolverine stack or BPC 157 and TB500 interesting. Because maybe you've had shoulder issues, maybe you've had Achilles issues, or maybe your elbow ruins your pull days when you go to the gym. And then having something like BPC 157 and TB500, where we always hear about healing, about recovery and repair, it makes sense to look into this stuff. And I agree, but we have to ask ourselves some questions before we do that. Because we're getting into advanced territory, and most of the times, most issues can be solved very simply. If you want to follow along, you can download my free peptide overview guide, and you can use that while watching this video to get a better understanding of the peptides overall. Now, I saw a man in his early 40s who trained hard and knew a lot about recovery. And he asked me about BPC 157 for a tendon problem. But before we got into that and we looked wider, his sleep was poor, his recovery changed from week to week, his libido had dropped, and he was basically holding his training together using coffee. Now, his issue with the tendon was real, but adding a peptide or a compound without looking at the rest of his body could have meant that we just treated the symptoms without looking at the underlying cause. And this is why I care about this topic so much, because I work with smart men who like to collect tools, but when it comes to their bodies, they don't always look for the underlying issue or the cause. And this can lead to waste of energy, waste of time, waste of money, because they didn't ask a better question first. They asked, which peptide should I take? Instead, they should ask, why is my injury failing to heal? But since we're here talking about peptides, let's have a look at the screen and talk about what BPC and TB500 actually does. Now, BPC may affect signals that help damage tissue organize repair, and TB500, which is sold as a related thymosin beta-4 peptide, is involved in cell shape and movement. So you can look at it as a building site, right? The BPC may help organize the job, and the TB500 may bring repair cells that need to reach the damaged tissue. And so that may sound logical, but we have to go a bit deeper, because peptides can definitely have their place in a supervised plan. You have to look at your injury, your medical history, which kind of product or compound are you trying to take, other medications, and the overall risks associated to this. And so the person supervising this kind of treatment should know both the peptides, but also the rest of your body. Because like I said before, peptides are a possible tool inside a supervised plan. And there are many positive anecdotes and stories about patients, about clinicians, about athletes using some of these peptides. And I don't think we should ignore them at all, but we have to be asking deeper questions as well. Because ignoring those stories, those positive stories, would be a huge mistake. But not digging deeper and figuring out whether each man actually has a need for this, or has he even looked at the underlying cause. That's the first question that I would ask in such a setting. And so that's why treating everyone like a peptide would magically work would also be a mistake in this case. And so for that reason, I think we should talk about what the studies that we do have actually shows. Because the human evidence is very small currently. A 2009 study showed that they had blood vessel growth using BPC. And this was during muscle and tendon healing. And in 2017, they found another possible repair signal. For thymosin beta-4 or TB500, we have a paper from 2012 that show the peptide associated with cell movement and repair. But we have to be honest, because the evidence we have, the evidence level is still on very few people. There was a study that showed an improvement, but it was only in 12 women, and they had bladder pain. Another study where they looked at the safety only looked at 2 adults. And so that's 12 and 2. And again, it doesn't give us a clear answer whether this would help wound healing in all settings, for all tendons and all repair mechanisms that we need in the body. Now, this is what I want you to remember, because how something works is not the same as whether it would work for your injury. And we haven't even asked what's in the vial or whether it's clean or not. And so recently, a few weeks ago, the FDA had discussions about BPC and other peptides and whether they should approve them for compounding. A lot of positive things came out of that meeting, but again, just because it was discussed and there was positive things, it doesn't mean that these peptides are approved. Because then we have the cancer question. Now, some of these drugs, these peptides will increase angiogenesis, the blood vessel growth, right? We know from the literature as well that cancer also increases the angiogenesis. Now, this one thing doesn't equal the other. So it doesn't mean that just because you're taking peptides that you will increase your cancer risks, but you have to have that in mind. And that has to be one of the questions you ask yourself. What is your cancer history in the family, for example? Now, if we ever get those studies, I don't know if we will, but maybe we will. I'm not sure it will show that these peptides will increase the risk of cancer, but for now, we simply don't know. And so that's why it's very important to ask that question. Because the safety also changes with how the product is taken. Is it oral? Is it injections? How much are you taking? What's the dosage? What else is that person uses? His medication history, his cancer history, fertility plans, all of these things have to be taken into account. And then obviously the injury itself. Now this is also where the problem becomes real, because I've seen men arrive with their compound already chosen. One man in his 40s had tried supplements, peptides, and several changes to his training. And he could still perform at work, but his body kept failing at home. And he simply thought that he needed a stronger recovery stack. But when we walked a step back and we looked at his sleep, his hormone levels, his injury loads, and the order in which he was adding stress to his daily life, we came to a different conclusion. Because you could have 2 different men who has the same pain, but where you have different cause, right? You could have man A, where the injury needs proper rehab and less repeated stress. While man B, you have to look at his sleep, his hormone levels, his energy intake, his food, and another health problem that's slowing his recovery. And so they could show up with a sore shoulder, both of them, but how you would treat them would be completely different. This is the kind of case that I work through every single day in my private one-to-one program. If your body feels behind, even though you think you're doing the work, and you want someone to look at your routines, your daily life, and how you can fix this, you can apply to work with me. It's going to be one of the links in the description below. And that's where we look at your life privately on a one-to-one basis and figure something out for you customized. Now, this is for very few men who's actually watching this video, and it's usually for someone who has money than they have time. But if that sounds like you and you want to really improve, you can have a look at that. Because this is the point where expert help actually matters, because facts don't make a plan. You can understand every single word in this video and still make the wrong decision. Your blood work, your sleep, your fertility goals, your cancer history, medication, training, injuries, all of these things and even more can change the answer for what's right for you. And my work is built around a very simple job. Look at the whole picture, choose the right angle to attack, and stop a man from going towards the wrong problem. And I see very smart men, very disciplined men build their health plans based on podcasts, lab reports, and AI summaries. And they know many things, but all of these facts don't make one clear, coherent plan. And so even if you never work with me, at least I want to give you this. Use these 5 questions before you make any decision and before starting any protocol or compound. And so I would always ask, what exactly is injured? Is it a tendon? Is it a joint? Is it a nerve? Or is it poor movement? So if you don't know what's damaged, you can't heal the underlying cause. Question 2, what proof do we have in people? When you look at peptides, you always have to ask this question. Question 3 is, why is healing slow in the first place? Like I've said before in this video, is it poor sleep? Is it not eating enough? Is it working out too much? Low testosterone? High blood sugar levels? All of these things have to be taken into account as well. Question 4 is, what could make this risky, applying this kind of compound or peptide? Look at your fertility plans, cancer history, medication use, because all of those could change the answer for what you should do. Question 5 is, what should happen first? Because sometimes the first move is better imaging, proper load, better rehab, improving your sleep, or fixing another underlying health issue that you have. And a peptide discussion may come later, or it may never come at all. So use these questions to stop yourself attacking the wrong underlying issue. So, should you use the Wolverine stack, BPC and TB500? Maybe. But the answer should come after you've asked yourself these 5 questions and not before. And if you ever do start on something, I hope that you're doing it supervised by someone who knows what they're doing. And I admit it, BPC and TB500 are very interesting. And I hope to see way more data come out in the future, because we have so much positive anecdotal evidence already. But we have to be honest with ourselves. The reason that someone's tendon might not be healing properly might not be because of a BPC deficiency. Their underlying issue could sit outside of your tendon. But with that said, if you want help putting the picture together in the right order, you can apply to work with me on a one-to-one basis. There's going to be the link in the description below. And if you don't necessarily need customized help, you can look at my Apex Performance group where we help men improve their libido, their energy, and their performance. And if you don't want any of that, watch the next video on BPC 157 alone, where we talk about pills versus injections.